with Enlight Physical Therapy. Welcome on this very hot afternoon. I'm not gonna lie, I'm gonna sweat. It's really hot out here, but we're gonna do this anyway. I'm excited to talk to you about our topic today. It's plantar fasciitis, which is one of the most common causes of pain and weakness and limitations that happens to the foot, okay? So let's start with the what. What is plantar fasciitis? Pretty important thing to know. Plantar fasciitis, it's fascia. So that means it's a really tight band of tissue that runs from your heel to the ball of your foot, okay? Just a tight band of tissue. Not a muscle, not a tendon, not a ligament, just tissue, okay? And what that tissue does is it helps support the arches of our foot. So you have two arches in the foot. You have the longitudinal arch and which kind of this big one here that we all always see on this side of the foot. And then the transverse arch that runs horizontal, okay, to the bottom of the foot. So those are the two arches, and that plantar fascia supports those arches, all right, and helps give our foot form. So what plantar fasciitis is when that arch becomes inflamed. So it can become really tight, whether we started at different new exercises or exercising on a different terrain. We got new shoes. We started really increasing our amount of exercise in a short period of time without really warming into it. Sometimes it's caused by obesity, age, sex. Generally, women get it more than men do, and usually it's over the age of 40. So these different types of issues can lead to plantar fasciitis and whether you're going to get it or not, your risk factors for it. So in this video, I'm going to discuss several simple exercises that you can easily do at home to help work through plantar fasciitis. All right, so the first thing that we're going to be going over is just stretching. A series of stretches to target that plantar fascia and the muscles of the calf. All right, first one is for that big calf muscle, that gastrocnemius muscle, the real thick one in the back of the calf. So take a pillowcase, a towel, a sheet, a belt, or if you have like a yoga strap or anything like that, something stiff and sturdy, and you're gonna put it around the ball of your foot, okay? Keeping your leg nice and straight. Try to keep that back flat. Try not to round through the back. And you're just gonna gently pull towards you, okay? Hold for about 30 seconds. After 30 seconds, you're gonna release. Nice and gentle. As you're stretching, make sure you're not pulling into pain. Very gentle stretch. About 30 seconds and release. You can do that a total of 3 or 4 times, all right? The second one, you can take a pillow, you can take a towel and roll it up. If you have a yoga block or a yoga bolster, those work really well as well. You just wanna bend in that knee, okay? Again, you're still sitting up nice and tall, back flat. Go back to your pillowcase, put it around the ball of your foot, and gently pull back. So this one targets the soleus muscle, which is also in the calf, but deeper and lower, okay? So you'll feel it a little bit lower. It generally won't be as strong as that gastroc muscle, okay? So pulling back, again, holding about 30 seconds, and then release. A total of 3 or 4 times, okay? And then release. And the third one that we're gonna go over, I want you on your knees, okay? You're gonna tuck the balls of your feet underneath and just gently sit back on your heels, right? This one is not going to be the most comfortable. If you have any tightness, any tension, that foot where that plantar fascia is, you'll feel a real stretch with this one. So be gentle, okay? What you can do, if you have limitations in the bending of your knee, you can take your pillow, put it behind your knees and sit back on that, and you won't have as much bend in those knees, okay? And it'll also put a little bit less pressure and stretch in the sole of that foot. All right, let's move on to the next couple. So massage, which we call soft tissue mobilization, is incredibly important for that plantar fascia. If we want those tissues to realign properly and to improve the mobility throughout the fascia, we need to massage it. Now, not everybody at home can have someone massage their foot regularly. So what I always recommend is take a ball, Generally something dense, okay? A tennis ball is okay if you have nothing else, but it's a little bit, it kind of squishes a little bit if you put more pressure through your foot. Golf balls are great, but they are harder, so they have a tendency to be a bit more painful. I really like lacrosse balls. They're dense, but they're softer on the outside, so it doesn't bruise your foot as much. But whatever you have, in all honesty, my husband was having this issue the other day, and he used my son's bouncy ball. So whatever you have that's relatively dense that you can roll under the bottom of the foot is wonderful. So you're gonna take a ball, put it under your foot, and literally roll it back and roll it to the front. Okay, all around the bottom of that foot, wherever you feel that soreness, okay? And just setting a timer, an alarm. Do this while you're reading a book, playing on your phone, watching TV, what have you, okay? About 3 or so minutes. You don't have to do it super long because it is gonna be really uncomfortable, but you wanna do it, and honestly, I would recommend several times a day. Right, about probably at least 2 to 3 times a day for about 3 minutes each. All right, so that's the first one. Next, all right, so again, kind of goes along the same line of getting some mobilization to the tissue on the bottom of the foot, but at the same time, frozen water bottle. So it's very, very cold, okay? That ice helps to minimize the inflammation on that bottom of the foot. And what it also does is it numbs the area. So by numbing the area, that pain kind of goes away. But with the ridges on the bottle and rolling it under the foot, what you're also getting is some of that soft tissue work at the same time. And it's going to be very cold, okay? Put it under your foot. Whoo, cold. Okay, and you're rolling back and you're rolling forward. And again, I recommend put a decent amount of pressure through that foot so you really get the benefit of it. You're gonna feel that real cold, okay? So it generally goes from cold, you feel really cold, kind of burns a little bit, to it kind of hurts a little bit, and then it goes numb, okay? You gotta push through all those phases, all those steps to really get the benefit of this. But again, 3 to 5 minutes, you really don't have to do it any more than that because you're putting such a cold piece under that foot. Any further than that, and there is no benefit, okay? So just decent pressure through that foot and rolling it on that bottle. Okay, so we're on to the last one, the last exercise. This one, just as the other ones, is incredibly important. So we went over stretches, we went over that soft tissue mobilization, the kind of massage to the bottom of the foot, both with the ball and the frozen water bottle. And now what we need to focus on is stability of that ankle. A lot of times plantar fasciitis comes up because that foot is compensating for something. And usually it's due to some instability in the leg or in that ankle. So we want to make sure we're giving that ankle and that leg some strength. Okay, there are so many exercises that you can do on single leg that'll work on challenging balance and challenging stability. One of the easiest is just a single leg stance. All right, so balancing on one leg. So for us, we're gonna work on tree pose because we love tree pose. So you're gonna stand on one leg. You can have a chair next to you if you feel like your balance is a little off. So a chair, or do it next to a kitchen counter, bathroom counter, couch, anything that you can kind of tap if you feel like you're gonna fall out of it a little bit, okay? So that foot can go anywhere below or above the knee, okay? I generally don't recommend right on that knee joint because the force of that leg pressing into the knee is just not great for that joint, so let's avoid that. So you can go here, kind of like a kickstand type thing, okay? Or you can kind of come up to the middle of the shin. That's usually where I end up. My balance is not 100%. So I usually just go right to that middle of that shin, kind of keep the hands here, whatever feels good, okay? So balance, I highly recommend about 10 seconds and then lower down. So 10 seconds, 10 times on each leg. Even if you're only having the issue on one foot, it's best to work on both legs because whether the other leg is weak as well and it just hasn't developed it because it's not your strong side, or whether you've been compensating with the other side for so long that now that it's starting to get worn down itself, you just really want to make sure you're strengthening both sides, okay? So again, kind of grounding down through that foot, picking up that other leg. Oops, a little too close to the chair. All right, picking up that other leg and balancing. Again, about 10 seconds, 10 times. I really hope you enjoyed this video. I really hope you found some benefit from it. We covered stretches, we covered some soft mobilization to the bottom of the foot, and we covered ankle stability. All important things to try to treat that plantar fasciitis. If you go to my website, enlightphysicaltherapy.com, there's a blog about plantar fasciitis, and you can get some more information there. And if you're ever doing these exercises and they either hurt too much, or you're not sure you're doing them correctly, or you just feel like you need a little bit something extra, please go see your physician and discuss this with them, or go see a physical therapist and discuss this with them. Their fingers are magical, they can do wonders. It always helps to go see an actual doctor or physical therapist about this issue, because they can do so much more than I can do in a short little video like this and give you much more information. I really hope that, like I said, you got some benefit from this, and have a wonderful day.